and clinicians struggle with most, I think, is neurodevelopmental assessment of children. I think we need to examine the reasons why this is a problem, but also why it's important that we overcome these problems if we're going to train you properly in pediatrics. I think it's a problem for a number of reasons. First off, as I've mentioned in a couple of the videos already, pediatrics is often about spotting what's not there. And developmental assessment is all about spotting what's not there. Sometimes we will find physical signs to help us, such as a child with increased tone that suggests that they got a hemiplegia, as well as the fact that this child is not learning to walk and crawl normally. But often the initial prompt is somebody spotting that something is missing. And I think this is hard, and it's a hard skill because this leads me into the second problem, which is that it's not like growth where you could just do a simple measurement with a standardized tape measure, plot it on a chart, and compare the results with the chart. For developmental assessment, this process is the analogy of knowing what a question is, asking that question appropriately, getting the required result back from the child or the parent, and then having in your head how this compares with the normal range. This is incredibly complex because it requires that you know all the right questions, you can ask all the right questions, you can get the data back, and then you will have potentially hundreds of data points in your head in terms of what normal looks like. And I think that this is just setting us up to fail if we think about this. The problem, I think, is that we think about development in terms of milestones. We think of it as a bunch of events. I learned to crawl, I learned to walk, I learned to say 20 words or whatever it is. Like the child wakes up one day and suddenly can do this. And I think this is really unhelpful because it makes students and clinicians feel like they have to learn all these data points or not bother at all. And I think for many of us, the answer is not to bother. So I think we have to have a coping strategy for how we're going to approach this. And this is how I would like to suggest that you approach it. First of all, I think you have to get this done. The reason why you have to get this done is because if you're going to assess children, there are three reasons to be able to do a neurodevelopmental assessment. First off, how on earth are you going to assess a 2 or a 5 or a 6-year-old child if you don't know what they should normally be able to do when you see them and how to approach them in terms of the sorts of language or approaches that might be useful? So the basic history and examination is entirely predicated on you knowing what's probably going to work or not work and roughly what that child should look like when they're healthy. Because this leads to the second reason for knowing it, which is that any child who's unwell may behave in a way that is not neurologically normal for them. They may not talk or move in a way that is age appropriate simply because they've got an acute illness. But thirdly, if they've got an acute illness affecting their nervous system, this is how pediatricians do a neuro. In other words, there is no point doing a standard cranial nerves examination on a 2-week-old or a 2-year-old. It is not going to work. But 2-week-olds and 2-year-olds can have strokes or Bell's palsy or cancer or can have any number of neurological problems. And the way we do a neuro is to do a neurodevelopmental assessment. And therefore, if you're going to assess children, you have to be able to assess their nervous system. And if you're going to do that, you have to be able to understand that the neurodevelopmental assessment is just as integral to us as pediatric clinicians as being able to assess jaundice or abdominal pain. So therefore, we have to have a structure. And my structure would be this. I think you have to take into the room a normal child in your head. In other words, for the purposes of this talk, I'm going to ask you to bring a normal range 1.5-year-old child in your head into the room with you when you see a child of that age. And you can compare what you have in your head with the child in front of you and ask yourself a question. What's wrong with this picture? What is missing? Because what you need to be able to do is think, oh, this child is not doing that thing. I wonder if they could do what a normal 1-year-old could do. Or if they're not doing that, are they able to do what a normal 9-month-old is? Now, the rate of developmental change goes up massively over the first year or two, and that's why the milestones are closer together, and that's why it's harder to do a neurodevelopmental assessment to tell the difference between a 6 and a 9-month-old child compared with a 3-year-old and a 3-year-old and 3-month-old child. And therefore, we've got to really focus on the first couple of years worth of developmental assessment to get this right. And I want you to go into the room with a rough idea of what a healthy 1.5 to 1-year-old child would look like. So you have an approach to them. You have an approach to talking to them and getting them to do things. You have an approach to thinking about them generally, and you have an approach to doing a neurological examination on them. This requires that you've had a structured way of thinking what healthy looks like. And really, I'd like you to think about this. We think of it in terms of motor development, and we divide motor development up into gross motor and fine motor. And then when we're thinking about gross motor, we think about it really in terms of the ability to go from a baby who's lying in the cot and basically pretty useless at doing anything very much, but has got symmetrical power, tone, reflexes, and got some primitive reflexes, which you may hear about. 6 years later, that child is at school. They can stand on one leg. They can probably ride a bike. They can hop and they can skip and they can run. And development of gross motor is that sweep that takes them from a newborn baby to a healthy school-aged child. When we think about fine motor, we often put vision in with that. Vision's quite hard for us to assess in a screening sort of way. Generally, I think the most useful question is, do you have any concerns about your child's vision? But you may pick up on the fact that the child doesn't appear to be seeing you, or that there might be a problem with their gaze or the way that their eyes move, or they might have a squint. But really, in terms of fine motor and vision, what we're really trying to see is the ability for that child to learn to do that. In other words, put their thumb and forefinger together and do useful things with it. And useful things generally mean drawing or writing and building. And so fine motor development and vision we assess by their ability to draw and write and build things. The next area that we think about in terms of development is language, and we divide language up into receptive language and hearing. In other words, what can they hear, which is a hard thing to assess for us. And generally, I would ask, do you have any concerns about your child's hearing? So that would be hearing and receptive language. What do they understand? Now, we've got to be really careful. A parent might say, yes, my child understands because when I tell them to go and put their shoes on, they're going to put their shoes on. Now, it might be that every time that parent says that, they're also putting their shoes on as well, and the child is guessing and they're deaf or they don't understand. So receptive language and hearing can be quite hard for us to assess. Expressive language is all about our ability to go from a baby who basically cries, and it's a digital, very effective form of communication, but it basically says, I'm cold, I'm wet, I'm hungry, I'm bored, I'm cold, I'm hot. Anything that's wrong in my world, I'm going to cry. Whereas by the time they go into school, they're using complex syntactic language. They're using past tenses. They're using abstract concepts. They're using plurals and verbs and negatives. And they're using really complicated language. And how do we get from that to that? That's that sweep of expressive language. The final thing we would think about would be social skills. And this is difficult because you can imagine that when we were evolving as a species hundreds of thousands of years ago, our gross motor, our fine motor, and to some extent our expressive language was quite structured and quite logical, whereas social skills and social development varies from culture to culture and place to place. But generally, if we think of it in terms of interpersonal, well, it's how do I interact with close adults and how do I interact with unfamiliar strangers, whether they're adults or children? And how do I start going from the child who will basically do very little other than soothe to a loving touch and calm, nurturing and feeding and whatever, through to a child who's at school age, who can understand games, who can understand reciprocal play, who can form friendships, who can understand the rules of friendships and rules of games? So that's one half of social skill. The other half is that personal. And this is really about dressing, toileting, and feeding. And again, this is very much sort of culturally biased. But a newborn baby, what can they do? Very little, but they can feed. They will root and they will suck. Whereas by the time they're at school, they would be expected to dress and undress themselves. They'd be expected to take themselves to the toilet, and they would be expected to be able to sit down and eat solid food and drink. And so when we're thinking about development, what I want you to do, and we're going to focus on a 1.5-year-old child, but I want you to think, if I'm going to go into a room and see a 1.5-year-old child, where are they on that sweep from the newborn baby in terms of gross motor, fine motor and vision, receptive language and hearing, expressive language, personal social, and interpersonal social? Where are they on that sweep from newborn through to school age? And if they're not meeting what I would expect from that child, then I can dial back one and I can think, well, are they doing that skill? And if they are losing skills, if they've lost skills, then I've got to think, well, are they globally delayed or is this a specific delay? And then if they're globally delayed, what might be the causes of global developmental delay? If they've got a specific delay in language or fine motor or gross motor, what might be the causes of those? And that allows us to just start thinking about causes of developmental delay. So if I'm thinking about a 1.5-year-old, for me, the first year of life, I have a 1-year-old child in my head, and that 1-year-old child has learned to sit, they've learned to crawl, they've learned to pull to stand, and they might be starting to move along holding on to things. That 1-year-old child is just starting to develop a pencil grip and pick objects up between their thumb and forefinger. They've gone from that to that. That child has gone from crying to playing around with sounds, what we call babbling, to starting to do ba ba da da ba na ma ma ma, those basic consonants, to start chopping those into little words, mama, dada, baba, nana, whatever your culture has for mum and dad, you probably started doing those by the age of 1. That 1-year-old is moving over to solid food and has weaned appropriately and will pick food up and put it in its mouth. It's no good at toileting itself or dressing itself. It will recognize familiar people and it's just starting to get stranger anxiety and worry about unfamiliar strangers. So that's a 1-year-old. A 2-year-old in my head has learned to walk and is now starting to learn to run. That 2-year-old has progressed that pencil grip. They're now doing scribbling. They'll now put one block on top of another block. So they're starting to use that pencil grip, both in terms of scribbling, but also putting one block on top of the other block. In terms of their language, they've gone from mama and dada to maybe 15, 20, maybe even more words. And they might even just be putting 1 or 2 words together. They might be starting to help with dressing themselves. They're certainly starting to be able to feed more efficiently with a spoon, and they might be drinking from a sippy cup with a spout in terms of feeding. And toileting, they might just starting to be showing awareness of needing to go to the toilet, open their bowels or do a wee. In terms of interpersonal, they've come through that social, that stranger anxiety thing. They are still fearful and wary of strangers, but they are now starting to get better at what we might call reciprocal play, whether they're doing Incy Wincy Spider or they're doing particular games where they're starting to understand, you do this, I do that, or I'm going to mimic you doing this, brushing the doll's hair, or starting to copy what adults are doing, starting to be more complicated in the way they think about social constructs. So I hope what you can see is if I've got a 1-year-old and a 2-year-old in my head, well, that helps me to break up the first year of life and the second year of life, when I can start being a little bit more precise about where that child is on that journey, I can take that child in my brain into the room and I can be thinking, ah, this child doesn't seem to be using their hands very much. I need to get them to do this and try and see what the skill is. This is a screening test. This is not a detailed neurodevelopmental assessment, but it's an important part of pediatrics, both in terms of interacting with the child and knowing what's going to work, thinking how well they are or sick they are generally, but also thinking about their neurological assessment. Because if the child's not walking properly, I might be thinking, well, is this a nerve pus or problem or a neuromuscular problem? Is it upper motor, lower motor? Is it there a problem with the child's bones or joints, just as I would do with an adult? And we'll think about that a bit more when we do the abnormal gait talk. But for development, I'd really like you to spend the session thinking about those areas, thinking about those milestones, and thinking about the approach you're going to go to a room with a 6-month-old, 1-year-old, 1.5, 2-year-old, and how are you going to assess that child in terms of their neurodevelopment? Thank you.